We begin the discussion on an issue making headlines. Globally speaking, COVID-19 now has infected more than 3.5 million people. The US has the highest number of reported infections, as thousands are still being infected daily. For some people who get COVID-19, the symptoms are limited to a cough or a fever, but others experience extreme pain and discomfort, including strong aches and shortness of breath. With hospitals overwhelmed as they are, many infected have to fend for themselves, and recovery time can take several days to weeks. Today, we speak with a Washington State resident who recovered from the virus to hear about what it was like for her and her husband, Chris, and what we can do to support those who have the virus. Susan Kingsbury, Kane, thank you very much for joining us.
Yes, thank you. Good to be here.
Well, first, Susan, please walk us through how your husband initially became infected and what made you suspect that you caught the virus as well?
Okay, sure. He travels a lot for his job, and he had been at a trade show, international trade show in Florida. And when he came back, he had a little bit of a dry cough. And sometimes he would just get a little cough from traveling. We always called it an airplane cold, so we didn't think that much of it. And at that point, it was still pretty early into learning about this COVID-19. And so we really did not make that connection. And that was, he came home on a Friday. And then by Sunday, he was coughing enough that I said, you should probably take some cough drops with you to church. It still wasn't a big deal here. We didn't hear that much about it. But by Wednesday, he had a high fever that Wednesday night, very high fever, and Thursday went to the doctor, and he was tested for flu A and B, and for strep, and they said he didn't have any of that. And so then Friday morning, we went to the ER because I knew he was really sick. And at that point, I was also starting to feel pretty bad, but we just made him be the patient. I wanted him treated because he was coughing so much. And they did all the same tests, and they did a chest x-ray, and the chest x-ray showed that he had viral pneumonia. And they said, well, now that you have viral pneumonia, we will test you for COVID-19, but that'll take a few days to get the results. So they sent us home. And when I brought him home, he was very sick and I wasn't feeling good. But I kind of set up a room for him away from my room, just from our bedroom, just to keep him separate, just thinking maybe I still didn't get it. And took care of him, made sure that he rested. I kept checking his oxygen. We have a little pulse oximeter that you put on your finger, and that helped me to see that his oxygen level was about, running about 92, which isn't that good. But I thought, okay, he's still getting enough oxygen, relatively speaking. And but then by Monday morning, his oxygen was 84. And so I said, that's it. I want to take you back to the hospital. 84, you need to be on oxygen. And so I called the hospital just to let them know. And they put me on hold for a bit and came back on the line and said, oh, he tested positive. And they said, you should just call 911 and get him here on an ambulance as soon as possible. And so I decided against that because we have a 16-year-old son here at home, and I just didn't want him to be so worried. So I just hopped in the car with my husband and got him down there. And they met us in the parking garage in hazmat suits and whisked him away, put him in a wheelchair, and just went off. And I went off over to the admitting area, and they said, well, you need to leave. And I said, well, I'd like to find out what's going to happen with my husband first. And so they let me wait, and finally came out and said, his chest x-ray is much worse. He needs to be on oxygen. You cannot see him, and you need to leave. So I left, and I think as I was driving home, it just started to hit me that I may never see him again. He may pass of this. We'd already learned of one or two other cases of people in the area that had actually died from it, even though it still wasn't very prevalent. And as I was driving home, I guess I was just thinking about my daughter is getting married this summer in August, and I just thought, who is going to walk her down the aisle? And I just had the tears streaming down my face, and I thought that was it. And he couldn't really talk on the phone even at all, because he couldn't talk without choking and coughing and gasping for air. It was not anything I've ever seen before. So, I got home and I just started to pray and told my family members what was going on. We have 4 kids, so 3 adult girls who don't live at home. I told everybody to pray for Dad, and then his doctor called me and said we would like to put him on a trial drug called remdesivir. And he said, we saw this help the first patient in Washington State. And I said, yes, please. So he did go on that drug, and it was taken by IV 1 time per day for 5 days. And within about 48 hours, he was feeling a lot better and was able to come home on Saturday. But while he was gone, I was still dealing with it. I had to go get tested, and my son had to get tested. The health department told us to get tested, and we both tested positive. We did have milder cases, but it didn't feel great. It felt, bad headache, bad neck ache. It was strange. I didn't really get the cough. Nothing like my husband. And then I had the emotional aspect of just thinking, maybe I'm not going to see him again.
It just sounds like a very long and tormenting process, even just to the point of getting him the proper treatment that he needed.
Yes.
And well, I'm so glad to hear that he's recovered fully now. And this drug that he was getting, how did he respond to that?
Yeah, really fast. Really, within 24 hours, he started to feel better. He started to feel the pressure lift off his chest a little bit. And he could talk a few words on the phone without coughing and choking. And then by 48 hours, at the 48-hour mark, he'd had 2 doses. And at that point, he was saying, I think I can come home now. And I said, oh, no, you can't come home. I said, you need to take all the medicine, stay there, let them give you the medicine, and, keep getting better. And then he did. And it just, as soon as he was done the 5th dose, he was discharged, and I was able to pick him up. I still wasn't allowed to go in the hospital to greet him, but I was able to meet him curbside.
So really, it really sounds like a very trying time for your family. And basically, when you get COVID-19, you have to self-quarantine, you have to get quarantined, and that's basically social isolation. And it's really a time when you need others the most. I mean, how does this process make you feel?
There's a lot of tears, a lot of just an emotional aspect that we have some good friends, and they dropped off some magazines and books and a coloring book, an adult coloring book, and some food on our porch. And we had a lot of people texting us and just, prayers. And so the response from friends, it felt good. But, since then, it's like, people just, still aren't sure. It's been about 8 weeks, and people aren't sure. Maybe we might still be contagious. People don't understand it that much. We're not contagious.
Exactly. Even close friends, family, they still might be unsure, right? And I can't imagine how hurtful that must feel. Well, also with your daily life as well, I mean, working and also just engaging in daily activities with your son, how did COVID-19 affect those elements of your life?
Everything shut down so quickly. He was already homeschooled prior to this, but he took some classes off-site, out of the home, and so that stopped. He is a Boy Scout, and he's on the road to becoming an Eagle Scout, and Scouts completely stopped. Church stopped. Everything stopped. Everything came to a standstill. And I've seen the stress in him. He's normally a very happy, very just calm guy. But I've seen the stress of this getting to him quite a bit, and getting to all of us. People can tend to be maybe a little bit short-tempered, or just, just maybe more emotional than we normally would be. It's very stressful. It's very hard to not see family or friends, not be allowed to go anywhere. It's hard.
Well, we have heard reports of some people getting better but then relapsing. Have you ever worried about that? Worried that you are feeling lingering symptoms maybe, or that you might get sick again?
I have read some stories like that, and I think I would say that there is a concern because it's so unknown right now. But I'm choose not to feel afraid of it, but I will take precautions that they keep talking about, to wear a mask and when you go out to a store, or to, make sure you keep washing your hands all the time. I carry antibacterial wipes with me to wipe down the grocery cart. And I don't want to get it again. I don't know, maybe the next time around my immune system won't be so strong against it. I mean, I don't know. But we have had our blood tested and we all have antibodies against it.
That's really encouraging to hear. And
yeah.
It is really encouraging to know that we have a support system behind us. And during this process that you were infected and you were getting treatment, your husband was getting treatment, did you feel in any way that perhaps the government or medical workers, what kind of support do you think that they could provide better, I suppose, for infected people?
I think, I think coming out of this, the number one thing would be to make sure that there is plenty of the personal protection equipment available for everyone. I just don't think any healthcare workers should have to worry about whether or not they have personal protection equipment. And I think it should become something where, everybody can have their own supply of PPE, as we like to call it. And so that when you go out to the store, sometimes you'll see somebody is just wearing a bandana across their face, but we've learned that that's not really effective. But I think going forward, the number one thing that we can probably do better is make sure all citizens, and especially all healthcare workers, all first responders, have everything that they need to be successful and not be exposed.
Yes, our medical workers, they need the protection and support all the protection and support that they can get. Well, just before we go, I believe you and your husband have now been helping other people get the information they need, and also helping the medical authorities with some resources as well. What kind of efforts have you been making in that regard?
It has been very interesting because we had some multiple researchers reach out to us and ask if they could get blood samples. And then, and so we said, well, sure, we can do that if that could possibly help somebody. And then they said, well, we can't really find a lab that will want to do that, knowing that you were all tested positive for COVID-19. So they said, can we come and set up a lab in your garage? We can't go in your house, but we can set up a little lab in your garage. And it was just all very strange, but we decided to go with it because we wanted to help people. And so we have had 3 different times where a lab technician came out and took our blood. And apparently it has been very helpful to the researchers, and they're actually developing tests based on our antibodies. And they keep calling us and telling us, you can donate again in the middle of May. So please put that on your calendar if you can, and please donate again. We need your blood. So we're going to do it. If we can help, we'll help. Whatever we can do, we want to help.
That's so wonderful to hear and so inspiring. I mean, hearing about even the lab in your garage. Well, I'm afraid that's all we have time for today, but thank you so much, Susan, for your time, and the best of luck to you and your husband and your son and your daughters as well. Thank you so much for joining the program today.
Thank you so much, and just take care and stay safe and healthy.
You too, stay safe, stay very healthy.
Okay, all right, take care, bye-bye.
Well, this is also where we wrap up the show. Thank you for watching. We'll be back Monday, Korea time. Have a great weekend wherever you are. Goodbye.